When you think of a nurse, you probably don't picture the two people you'll meet in tonight's To Your Health. Both are tackling their goals in more ways than one.
It takes a lot of discipline and commitment every single day. Focus on one thing at a time.
Pressure up front, Jacob Anderson.
You got to count on the man next to you.
Washburn University linebacker Jacob Anderson sounds like he's talking about football.
You got to take it step by step, play by play.
But he's also describing his life off the field as a student nurse.
The reason I wanted to be a nurse was because I wanted to make an impact and help other people.
While most other student athletes are enjoying the NCAA's mandated Monday off from team commitments, Jacob is suiting up for a 6 a.m. clinical shift at Stormont Hospital.
It's pretty tough to get through if I can just really be organized. 12-hour day on Monday. I'm up here again for another 8 hours on Tuesday. Then I have practice, film study, homework. Wednesday I have class all day, and I have homework to do after that, test to study for. So really it's just about me managing my time well.
If he ever needs advice, he just looks to the guy who lines up next to him on the field.
And just kind of the fast-paced action of it is fun.
Brooks Peevler, the leading tackler for Washburn in the first half with 8.
Fellow linebacker Brooks Peevler finished his nursing degree last spring. He too sees parallels between the football field and the hospital halls.
You never know what you're going to get. You study all week and you think you know what's going to happen on Saturday, but you get out there and they're running something totally different and you just got to adjust on the fly.
It's those skills that make their coaches more than willing to adjust the game plan for their demanding schedules.
Really the work ethic that they have. They may miss a practice or two or miss some drills or things like that, but they make up for it the rest of the time. They're fearless, they're competitive, they want to do a great job.
It's also why hospitals love to recruit student athletes to their team.
You're really learning how to work with people, how to motivate people, how to pump people up, how to communicate, how to read each other, how to have each other's back. And, you know, those are the same skills you need in life, but really in healthcare.
Never mind that other skill at which Brooks and Jacob excel.
I'm a linebacker, so I love tackling people. But when I'm on that football field, there's a certain mentality you have to where you have to turn it on. And then when you're off the football field, you kind of have to turn it off.
And after football, they're ready to help their new team be fierce defenders for their patients.
They trust you to help them get better, so it's rewarding.
And actually being here in person and able to practice these skills that I've been taught about and actually make a difference in patients' lives that I'm taking care of, that makes it all worth it to me.
Brooks and Jacob aren't alone. Washburn has had several student athletes balance their time from multiple sports in the nursing program over the years. And by the way, something a little fun, we first heard Coach talk about them on the Washburn Coaches Show on 106.9 radio. And then we realized Jacob is the son of 13 News morning reporter Phil Anderson. Dad should be very proud. More than 34 million Americans have diabetes. Most of those are type 2, which tends to develop later in life and is often linked to lifestyle factors. In tonight's To Your Health, we focus on the 1.6 million people with type 1 diabetes. It's something they're born with, including a little girl named Charlie. 3-year-old Charlie Puckett is all smiles flying out the door to spend time with her birds.
Right there.
You'd never know her little body is fighting a big battle.
You know, I had that tickle in my brain that something was going on.
Her mom, Sue, says the change came on in late winter.
She started drinking a lot more and urinating a lot more.
Sue is a nurse at Stormont. That training raised her suspicion, so she grabbed a glucometer she had from her own bout with gestational diabetes when she was expecting Charlie's older sister.
I checked her blood sugar and it was 281, and I knew what was going on.
Normal range is 70 to 100. They rushed Charlie to the hospital where she was diagnosed with type 1 diabetes.
Type 1 diabetes is an autoimmune disease. Something triggered her immune system, and her immune system got confused, and instead of attacking what triggered it, it attacked the beta cells in her pancreas, and she quit producing insulin.
Charlie spent 6 days in the hospital clearing her body of the acids it was producing to try to make up for the lack of insulin. That was early March. They've been piecing the puzzle ever since of how much insulin she needs to keep her body in balance.
Everything has changed for her. We have locks on the cabinets because she can't free graze. Everything that goes into her body, we have to try to guess and dose how much insulin she will need. And it's not just a set formula of, you know, she eats this and she'll get this amount. It's how active is she? Is she coming down with a cold? You know, how much insulin does she already have on board? Is the wind blowing from the north or the south?
Charlie has an alert bracelet and wears an insulin pump and a cell phone that acts as a continuous glucose monitor. It's linked to both Sue and her husband's phones and watches.
She's 166.
But all the alarms don't take away the sleepless nights.
You overestimate and give her too much insulin and her blood sugar drops in the middle of the night, she could go into a coma and die. And, you know, as a parent, it's hard to sleep soundly when you know that that's a possibility for your kid.
Despite the challenges, Sue says Charlie is blessed with a big brother and sister changing their own habits to keep her safe, and a care team at the Cotton O'Neill Diabetes Center guiding them through every step.
The bright side for us, fortunately, is that she was so young with her diagnosis. So life for her, she won't remember much of before, so this will be life for her.
While it sent Charlie in a new direction, her family is looking for a bright future ahead.
There's so many things that I hope for her.
The goose is named Bop Bop, by the way. Sue hopes sharing their story helps other families spot the warning signs of diabetes, like increased eating or drinking or unexplained weight loss, as well as signs a friend or colleague could be having a blood sugar emergency. You can learn more about those things on the health page of WIBW.com. A Topeka family is in a waiting game for a life-changing gift. Second grader Elijah Diaz is on the transplant list. His story is one of strength, support, and a lot of heart.
Okay, what do you want to do next, Elijah?
Elijah looks like a typical 7-year-old when he hits the playground with his sister.
He's a goofball. He's funny. He likes to make people laugh.
Here.
But behind the smile
Come on.
lies determination and a lot of heart, even if part of his heart is missing.
Because I have a half of heart.
Elijah was born with a congenital heart defect called hypoplastic left heart syndrome. So essentially the left ventricle was severely underdeveloped.
Elijah underwent his first open heart surgery when he was just 3 days old.
All of us have the left side of our heart that pumps to the body and the right side of the heart pumps to the lung. And Elijah really wasn't born with the left side of his heart.
Elijah's cardiologist, Dr. Brian Birnbaum at Children's Mercy, says typical treatment is a series of 3 surgeries. Elijah had the first 2, but his body hasn't responded the way it's needed to for the 3rd. His only option?
I'm gonna get a new heart soon.
He's now on the list for a heart transplant.
His oxygen levels are just decreasing.
I got you, sissy. I got you.
His heart function decreasing. The older he gets, the more I realize the less he can do like other people.
His mom, Allie Diaz, says Elijah never complains, even when he has to sit out gym class or falls behind on the playground.
Do you sometimes get tired? How does that feel?
Like I need a rest because I've been walking a lot.
We're going to see a sort of a slow decline if we're not able to find a donor heart for him, in the form of his oxygen saturations getting lower. And a lot of times that can lead to more damage to his other organs, such as his liver and his kidneys. We try to keep those organs as healthy as possible going into a transplant.
Which means the clock is ticking, and the reality is another family must suffer a loss to give Elijah a gift for which Allie says she can't even begin to express her gratitude.
I don't think there's any words that would make it better for that family, even if they're saving my son.
I think it's really important for families to have that discussion with each other. Up to about 14 different lives can be affected through organ donation. So it gives your family a chance to sort of keep that memory alive and really provide life and another life for lots of other families.
Allie says they've had a lot of support along their journey.
It's much appreciated to know, and to know that, we do have help and people that are praying for us and looking out for us.
Elijah expects he'll shift gears for a brief slowdown.
So when you get a new heart, you have to rest for a little bit and heal it.
Before jumping into a new future. No matter the outcome, his mom says his heart is full in every way that matters.
We're excited to see him play and run and keep up with the other kids. I hope that he gets to live a long, happy life.
That smile. He's so sweet, and Kinley's so sweet with him. Elijah's family has insurance, but they still face a lot of expenses. They'll be traveling to Kansas City already, often several times a week for medical appointments, and they likely have a 2-month stay there when Elijah gets his transplant. So I posted a link for a fund to help the family. You'll find it on the health page of WIBW.com. I will get it on my Facebook page as well. And by the way, Children's Mercy does partner with Stormont Vail to offer a pediatric cardiologist in Topeka, which has helped a lot of families avoid some of that extra travel. The recent rise in COVID cases is once again stressing Kansas hospitals. In Topeka, they are seeing triple the number of COVID-positive inpatients from a month ago. And tonight's To Your Health, we got an inside look at Stormont Vail's ICU to hear what they're dealing with and learn what the hospital is doing to ensure they can care for you if you need it. Inside this critical care unit at Topeka's Stormont Vail,
it is very hard that you're seeing the same thing again.
A new wave is rising.
Now we're seeing a younger group of patients who are not vaccinated, who are very sick, who tend to do worse than before.
Dr. Hassan Taha said beds are full. He spent a few moments with us before this room, too, would welcome a new patient. He said staff, thinking the worst was behind them after last winter's peak, are worried another hill looms ahead.
It's very traumatizing, especially when this could have been prevented in somebody in his 40s or 50s who can lose and may lose their life.
Prevented, say both Dr. Taha and infectious disease specialist Dr. Clifton Jones, if the half of the state's population not doing so would get the COVID vaccine. Dr. Jones says other factors also are driving case numbers.
A year ago at this time, we still had some acceptance of the need to be careful in group settings. There was reluctance, but a higher acceptance of use of face masks in public places.
Jones said an increase in COVID patients is coupled with more traumatic injuries, major illnesses, and regular medical procedures. So far, Stormont has not had to reactivate any of the additional spaces converted at the height of the pandemic last winter, and they have no plans to suspend or delay surgeries and other procedures right now. But they have taken steps to maximize staffing and available beds.
We're looking to increase staffing in our patient care areas in the hospital. We're setting up some additional training for people that are still licensed to provide patient care but have not.
Dr. Jones said Stormont is not yet requiring its employees to get vaccinated, but does plan conversations with the approximately 30% who've opted out.
What would make them more comfortable to receive the vaccine, what steps we could take to bring more people on board.
Jones and Taha say having an available vaccine is the difference in stopping another spike.
I want to be optimistic. I'm trying to be optimistic.
They encourage anyone with doubts to talk to their doctor, not consult social media.
People talk about it. They have no medical background. The vaccine is safe. It saves lives.
One other note, Stormont has not yet had to transfer any of its patients. However, they have had to turn down some requests to take patients from other hospitals that have become capacity. COVID vaccines are free to find medical offices, pharmacies, and upcoming community outreach clinics near you. You can click Find a Vaccine on WIBW.com.